Ready?
So the first station is hematuria. Could you please put a timer for 6 minutes, Ali?
Hematuria. Okay.
Yeah. Give me 1 second.
Before that, Ali, let me ask Ala, when did you review the station? The last review.
Like half an hour ago.
Excellent.
All right.
I shouldn't review it before the session, or is it's
No, no, no,
okay?
no. As you like. That's we will not determine that for you. It's just whenever you have time. 6 minutes is ready, Muhammad and Ala. Let's start.
Yeah. Okay. I start to start immediately.
Yes.
Okay. Hello, I am Dr. Al.
Material. Yeah. There. Sorry. Stop.
We can start again. Yeah.
Yeah.
Hello, I am Dr. Ala, one of the surgical doctors. Can you confirm your name and age, please?
Yeah, my name is James and I am 56 years old.
Nice to meet you, Mr. James. Today I will be taking care of you. Is this okay?
Yeah, that's fine, doctor.
Thank you so much. So, Mr. James, can you please tell me what seems to be the problem?
I have been experiencing blood in my urine and I am a bit concerned, doctor. Could you please help me?
I'm really sorry about this, James. I will help you, of course. Can you please tell me when did this blood start?
It started about a month ago.
Mm-hmm. And did it start gradually or suddenly?
Yeah, it started gradually.
Gradually, okay. And has it become worse lately?
Yeah, yes, it's becoming worse.
Okay. And does it come and go, or it is there all the time?
Yeah, it come and go, but it's worsening recently, doctor.
Okay. Is there anything that makes it better?
Nothing, doctor.
Is there anything that makes it worse?
Nothing.
What is the color of the blood?
It is red.
Red. Okay. And have you noticed any clots?
No, any clots.
Okay. Is this blood in the whole stream of the urine, or at the end only, or in the middle?
Throughout urination, doctor.
All right. Do you have pain while urinating?
No,
Okay. And have you eaten any beetroot?
no.
Okay. Have you noticed any unintentional weight loss?
Yes, doctor, I have lost about 15 kilo in the
Mm-hmm.
last 3 months.
All right. All right. And do you have any loss of appetite?
Yeah.
Okay. Um,
Also, there is a point, doctor, I would like to mention. I
mhm.
feel tired all the time.
Yeah, yeah,
Is that
yeah.
significant?
Yeah, because some problems comes with fatigue. Like when you sick, you get
Mm-hmm.
really fatigued. So that explains a lot to me.
Mm-hmm. Okay,
Okay? Yeah.
right.
Um, so, Mr. James, I would like to know if you have any urgency to go to the bathroom.
No,
Okay. And have you noticed that you go more frequent than you used to?
no, doctor, no.
Okay. And have you noticed any dribbling of the urine after you finish?
No, I didn't notice that.
Okay. Do you have fever?
No, doctor.
Okay. And um, can you tell me if you had any conditions like this before?
No, this is the first time I experience it.
Okay. Have you had any urine catheterization before? Urinary catheterization.
No,
Okay. Do you take any blood thinners?
blood thinner? No,
Mm-hmm.
but I'm taking paracetamol.
Okay, it's fine. Have you had any surgeries?
No surgeries.
Okay. Is there anyone in the family who has the same problem?
No one I am aware of, doctor.
Okay. Can you tell me, sorry, I would like to ask you some personal questions. Would that be okay?
Yeah, that's fine, doctor.
Okay. Can you tell me what do you work as?
I am an operator in a dye factory, doctor.
Okay. And who do you live with?
I live with my wife and two youngest daughter.
All right. Do you smoke?
Yes, doctor, I'm a heavy smoker. I smoke about 20 packs per day and for 20 years.
All right. And do you drink alcohol?
Occasionally.
Occasionally. Can you estimate like how many units per week?
You can say it about 2 units per week.
Okay. And for how long?
I'm not sure about this, but it could be 10 years.
Okay, 10 years.
Yeah.
All right. Okay. Before I go any further, I would like to know if you have any concerns.
Yes, doctor, I'm anxious and I'm afraid about this.
Yeah, I understand this. It's very scary to have to have blood in your urine. I understand, and I will try to make my best. All right.
All right, doctor.
Okay. So, Mr. James, what do you think the reason is?
I don't know, doctor. I don't know.
Okay. Yeah. And what do you expect from us to do to you?
Figure this out and treat me.
All right. Do you have any allergies from any medications?
No allergies, doctor.
Do you take any current medications?
No, no.
Do you have any other medical condition?
No.
All right. Do you have any headache or visual disturbance?
No.
Time is up.
Right.
Can you present your patient?
Yes, I would like to present James, who is 56 years old, presented complaining of painless hematuria, progressive, for the last 1 month. It is associated with weight loss of to 15 kilos in the past 3 months, and it is associated also with loss of appetite. There are no symptoms of calculi, no symptoms of UTI. So my main diagnosis would be bladder cancer, and I will also consider UTI.
Okay. What
UTI.
else? Yeah.
I forgot.
Yeah.
Urinary calculi
Yeah.
and yeah, that's it. Yeah.
Okay. What investigation will you request for this patient?
Okay, so the first thing I will do is abdominal examination, and then I will investigate. I will order blood test for him, including PSA, coagulation profile, full blood count, urea and electrolytes, and liver function test. And I will also order urine dipstick and cytology, and I will do cystoscopy and biopsy. And I will also do imaging like ultrasound KUB or CT KUB.
All right.
Yeah.
And if I ask you what's the most important investigation from the one you just mentioned, which one?
Cystoscopy and biopsy.
All right. Specifically for this patient, yeah.
Yeah.
How will you treat this patient?
All right. The first thing is I will discuss him with my consultant and in MDT. And according to the staging, if it is operable tumor, then I will proceed to do TERP,
What is that?
transurethral resection of bladder tumor, or radical cystectomy. If it is non-operable, then I will proceed with chemotherapy, radiotherapy, and immunotherapy.
Immunotherapy.
Yeah.
Fine. Okay. Yeah, I think you still have 1 minute. Do you want to add anything?
No, that's it. That's all.
All right. Muhammad, I will start with you.
Excellent presentation, Ala. I think I see improving in your presentation, and you finished the history session.
Within the time.
Yeah, within the time. So I will start from beginning. You introduce yourself in a nice way, and you take permission. You analyze the main complaint in a nice way, and the main point in analysis of main complaint is the pain, and you asked about it. So I'm so glad you mentioned it. You start by the first differential diagnosis, which is the malignancy, and this is a mark of professionalism. Uh, uh, I think you didn't miss anything in the history session, but in the presentation, you forget to say this patient working in a dye factory, which is significant for this scenario. Okay, and
Yeah.
also in your answers, I think you said something I forget. So if you forget answer, don't show the examiner that you are keeping something in your mind. Okay. So
Okay.
Yeah.
just you can say skip it.
Okay.
Yes. Or yeah, I asked you what's your differential diagnosis. You said UTI and urinary stone. Benign prostatic hyperplasia is unlikely, but it's one of the differentials.
Yeah.
If you forgot it, just say UTI and urinary stones, Sassy.
Okay.
Don't mention the word I forget. I forget. Don't mention it. Don't say I forget the name. Don't say I forget the age. Don't say I forget the name.
Okay.
If you forget the name, I took a history from this gentleman. I took a history from this lady. That's it. If you forgot the age, don't mention it or just make it up. It doesn't matter. According to all what you know. If you forget one of the differential, don't say I forget differential. Say that the differential I'm aware of. Okay, don't say it, but just mention what you know. If there's
All right.
something stuck in your mind and you can't bring it to life, just forget about it. Don't mention the word I forget. Okay. I don't have much to
Can I
say, but
ask the question here?
yeah.
Like if, for example, if the age, like sometimes I don't remember the age exactly. Like, is it okay to say whatever number?
Yes, they will not fail you for the age of the patient. The examiner doesn't remember your patient age. Even your patient age is just an actor. Nobody will focus too
Yes.
much on this.
Yeah, but it
So
is helpful if you go over it. So just say I took clinical history from this gentleman presented with skip the age at all.
yes,
Okay.
but I did make up the age for my station. One of my station, I'm not sure if I'm allowed to say it exactly, but I just made up the age. Nobody like the examiner doesn't what the word. The examiner don't remember the age. So you have two choices. Say I took a clinical history from this gentleman who presented with da, or make up the age. But the last and the most worst option is to say I took a history from this man. I forget the age. Don't do that.
Okay. Okay.
I thought, okay?
All
Or
right.
do as Muhammad said, if you want to be honest 100%, skip the age.
Okay.
Okay?
Yeah.
Okay.
Fine.
Also the point of abbreviated name of term. You say
Yeah.
term. Just say the full name
Okay.
because this is mark of professionalism also, Ala.
Okay.
Yeah.
Okay.
Yeah. It's not a medical, it's not a, you can say medical term to the examiner, but term is just an abbreviation. So that's why
Yeah.
you can say it all. I notice you ask the job in a unique way. You say, what do you work as?
Mm.
You can just say, because your patient may be not fluent in English. If you have your exam, you have it in London, but your patient may be Russian or different nationality, Romanian or whatever, then just say, what's your job? I think that's a simple way to ask it. Not what do you work as, okay?
All right.
Just to save yourself from any trouble if your patient didn't understand. For the next station, we're going to work more on the body language.
Okay.
For the next one. So
Okay.
I want to see your interference, how you approach the station, your body language, your face expression should change accordingly, okay? So you mastered the general stuff of introducing yourself, presenting your patient, differential diagnosis. Now we're going to take a step ahead, okay? So we are
Okay.
advancing in our performance. Okay, next station is
Back pain.
back pain. Okay, let me just save this one. So Muhammad, put the timer.
Yeah.
6 minutes. So you have a middle-aged man who presented with back pain. He works in a warehouse, and you have 6 minutes to take history from the gentleman.
All right.
6 minutes started.
Okay.
Yeah.
Hello, I am Dr. Ala, one of the surgical doctors. May I confirm your name and age, please?
Hi, Dr. Ala. My name is Jack. I'm 45-year-old.
Nice to meet you, Mr. Jack. Today I will be taking care of you. Is this okay?
Yeah, that's fine. Yeah, I hope
Thank
you
you.
can help.
Thank you so much. So can you please tell me what seems to be the problem?
I have this back pain, doctor,
Mm.
and to be honest, it's getting worse, and it does affect my lifestyle. I want to get rid of it.
I'm really sorry to hear this. I will try to do my best to make you feel better. All
I
right?
hope so. Yeah.
So, yeah, sure. So can you please tell me when did this pain start?
This pain started around 2 years ago. It does come and go intermittently. And I work in a warehouse. I think my job has element to it.
Okay.
And I did try multiple painkillers, but with no relief.
All right. All right. So did it start gradually or suddenly, this pain?
It started gradually and then build up. It's a nagging sharp, not sharp, but it's like cramping pain on my back. That's range in severity. Sometimes it will be very severe, and then sometimes it's just nagging pain on the back.
Okay. Can you please point to the site of this pain?
Yes, it's around here.
Okay, so the lower part of your back.
Yeah, lower back, yeah.
Okay, okay. So can you please rate it for me? I will give you a number from 1 to 10. Can you choose by 10 being the worst pain you could ever imagine?
Yeah.
Okay.
I would say in the worst case scenario it's around 9. And on lucky days it's around 2 or 3.
All right, all right. So I would like to know if you do any heavy lifting.
Yes, as I work in the warehouse, I do a lot of lifting, yeah.
Yeah. And did you have any trauma to your back?
I don't have trauma per se, no. No specific trauma, no.
All right. Do you have any leg weakness?
No leg weakness. My legs are fine.
Okay, perfect. And if there is there any loss of sensation in the anus area or genitalia or even in the legs?
No, it's fine. Yeah.
All right. Have you experienced any problem with your water work or bowel work?
No. They both working fine.
Okay. And do you have any problem with erection?
No.
All right. Okay, so I would like to know if you have any cough.
Cough. I had it, but that was 10 years ago. I'm not sure if that's relevant.
So it's not specific to this. Okay.
Yeah.
Okay. Do you have any fever or night sweating?
No fever, no night sweating, no.
All right. Have you noticed any loss of appetite?
My appetite is the same. I don't eat much, but it's the same. There's no difference in my appetite.
Okay, okay. And is there any unintentional weight loss?
No, my weight is the same.
All right, all right. So have you noticed any fracture that happened easily than expected?
No,
All
no, I
right,
have no fracture.
okay. So I would like to know if you had any conditions like this before.
Yes, you mean the back pain? Yeah, the back pain is, as I said, is being a long-term problem. It's not a
Okay,
recent one,
okay.
and it's fluctuating.
Yeah, yeah. And do you have any other medical condition?
I have diabetes,
Mm-hmm.
type 1. I have hypertension.
Mm-hmm.
Yes, those medical problems I have.
Okay. And is there anyone in the family who has the same problem?
Yes, my dad has this back pain. And my granddad also had the same back pain. So I think
Mm.
it does run in a family in a way.
Okay, okay. And do you have any allergy from any drug?
No.
Okay, no allergies. And do you take any drugs
Yes,
now?
I take metformin and lisinopril.
All right. So can you please tell me what is the dose of metformin and lisinopril and how?
Metformin I take 500 twice a day,
Mm-hmm.
500 milligram, and lisinopril I take 1.25 once a
Okay.
day.
Okay. All right. Perfect. So now I would like to ask you some personal questions. Would
Yeah,
this be okay?
yeah, that's fine, Doctor.
All right. Who do you live with?
I live with my wife and my son.
Okay. And do you have any difficulty climbing the stairs?
I sometimes, yeah, yeah,
Yeah. Okay. All right. Do you smoke?
yes, I do.
How many packs a day?
10 cigarettes a day, less than a pack.
Okay. And for how long you been smoking?
Since I was 15,
Okay,
so 30 years.
30 years. Okay. Do you drink alcohol?
Yeah,
Time
occasionally,
up.
not too.
Time up.
All right. Can you present your patient?
Okay. I would like to present this gentleman presented complaining of lower back pain for 2 years, intermittent, um, of sudden onset, sorry, of gradual onset. It is associated with heavy lifting. He works at a warehouse, and there are no symptoms of Pott's disease or ankylosing spondylitis or malignancy, and he is not known to be allergic to any drug. He is known to be hypertensive and diabetic. He takes for that lisinopril and metformin. So my main diagnosis will be mechanical back pain, and I will also consider ankylosing spondylitis, Pott's disease, um, osteoporosis, and malignancy.
What is the most dangerous differential diagnosis that you excluded already from your history?
The most dangerous is cord compression.
What's the name of the syndrome?
It's called quad equina syndrome.
Yes, and you already excluded in your history, right?
Yeah, yeah.
All right. And what's your management for your patient?
So the first thing is I will perform an examination, a back
Yeah.
examination, and I will do anal examination to test the sensation and the tone. And also I will perform a lower limb neurological examination.
All right.
Okay.
How
And
will you investigate?
I will order him blood investigation, including full blood count, inflammatory markers, liver function test, and RFTs. And also, I will do imaging. I will do lumbosacral X-ray, and I will also do urgent MRI if quad equina syndrome is suspected. Also, I might do DEXA scan in case of crush fracture. and I will also do chest X-ray and quantiferon TB if tuberculosis is suspected.
All right. And how will you approach the management for your patient?
Well, after discussing him with my consultant, I will start by advising the patient for exercise, and
Yeah.
I will give him analgesia for the
Yeah.
pain, and also I will refer him for a physiotherapist and for a
Yeah.
social worker.
Yes.
Yeah, so that would be the management, and also I will
Time
use
up.
some short course of muscle relaxants.
All right. Okay. And if it was malignancy?
If it was malignancy, then we'll do radiotherapy.
All right.
If
Good.
it is called iguana syndrome.
If it is Codd-Equina syndrome, I will give the patient dexamethasone, and I will do urgent decompression, either laminectomy or discectomy.
All right. Very good. All right. I just want to add one thing. I think we are improved on both sides, the clinical term and the communication, both of them, the professionalism. You are perfect. You just need to thank your patient at the end, regardless. Even if you didn't finish the history, and you still, let's say, you cut off your 6-minute cutoff in the examination part, in the differential diagnosis. Thank you, Jack, and then turn to your consultant, regardless you finished or you didn't finish. Thank you, Jack. Thank you, John. And then Muhammad, say time finished.
Time up.
Time up. Thank you, John. And then you turn to your consultant for the discussion. We're going to do that from the next station moving forward.
Yeah.
All right.
Yeah.
From the clinical point of view, I think on your presentation, you didn't mention that the neurovascular, the patient was neurovascularly intact. He has no numbness. He has no urinary incontinence or bowel incontinence.
Yeah.
So that's very important positive. That's very important negative. You didn't mention in your presentation. So you wanna, like, if you while you're doing, let's say you're doing a night and a patient presented like this, your consultant, his main worry will be Codd-Equina.
Yeah.
That's like, if it's not Codd-Equina, he will not be worried at all. So you have to reassure him by saying, patient has no neurovascular, patient has no neurovascular deficit, no numbness, and you specify no numbness, no paralysis, urinary and stool.
Dysfunction,
What the
erectile
word?
dysfunction, and erectile dysfunction.
Yeah. So you should exclude the Codd-Equina. You exclude it in the history, but you didn't exclude it on your presentation. So you should mention it on the presentation. That's all what I need to say. But otherwise, perfect. Yeah.
Ala, as you are being monster, so I will try you in hard way. I think you should start your scenario by an open question. Ali is a talkative patient, I know, but you need to ask the patient, could you please tell me more about this? You jump into, could you please tell me the site of the pain, the onset, is it gradually? But you should start by, could you please tell me more about this?
Hello?
Yeah, Ali.
What do
Yeah.
you mean? I didn't understand really.
Yeah.
Like,
So in the history station, for the mark of professionalism, you should start by an open question. Ali said he had a back pain, right?
yeah.
Don't jump to ask him, could you tell me the site of the pain? And then the
Okay.
next question. Just the first sentence you should say, could you please tell me more about this?
Okay.
Yeah.
Okay.
The next thing I would like to mention, you ask two questions at the same way. At the same time, you ask Ali, did you experience any fever and night sweats? Right. Separate your question.
Okay.
Yeah, it means same diagnosis as TB in your mind, but you should ask every question single. The last thing,
I couldn't hear you. What you said? I asked him about night sweating and fever at the same time. I shouldn't do that, right?
yeah. you should
Mm.
ask every question separately from each other. Okay.
Okay. Okay.
And even Ali is talkative patient. I think you manage this station.
Okay.
So I think Ali lost his internet connection. But at all, nice presentation. You are improving
Thank
day
you.
by day, Ali.
Thank you.
You would like to ask about
Inshallah.
anything?
No, I think all the feedbacks are great. I will try to follow them.
What
But yeah,
about the self topics? Did you read it?
yeah, I did. Although
Acute
pancreatitis
pancreatitis and
uh,
pseudocyst.
is annoying, but I try to manage.
يا
Yeah.
البنكرياتايتس دي تقريبا هي اطول حاجه في المانجمنت كمان، وبتيجي كتير في الكريتيكال كير. انا كان جاتني
Mm,
هيستوري لكن
mm.
فكاتبينها بالطريقه بتاعت الموكس. ان شاء الله اذا قريتها من سكول ما بتجي عوجه باذن الله.
لا أصلا قريتها من سكول هاي، لكن يعني داير لا قرية تاني،
ايوه ايوه.
لأنه
ما.
شوية ستيشن طويلة شوية كده،
ايوه.
توبيك طويل. Mm.
في اي كويشن تاني؟
No, all good.
بالتوفيق
Thank
ان
you so
شاء
much.
الله يا علا.
شكرا شكرا.
السلام عليكم.
آه.
حرفع السيشن طوال ان شاء الله في سكول. ها.
Okay, perfect. Bye bye.
جود باي.